Morning. I'm glad so many of you could join us virtually on Zoom for the St. Louis Regional Chamber's COVID-19 briefing with our regional health leaders. As COVID-19 continues to impact our region's communities, businesses, and governments, we look to our health leaders for their guidance and assistance on our continued road to recovery. Before we begin, I'd like to take this moment to thank all of our healthcare and other essential workers who are on the front lines during the COVID-19 pandemic. I'm Austin Walker, Vice President of Public Policy at the St. Louis Regional Chamber. Today, I'm very excited that we have Dr. Alexander Garza, Spring Schmidt, Dr. Fredrick Echols, and Barbara Hohlt on our briefing this morning to discuss our region's increasing number of COVID-19 cases and what businesses can expect going into the holiday season and the new year. I'd like to thank all of our health leaders for their leadership, continued support of the St. Louis region, and for taking time to join our briefing this morning. Before we get started, I'd also like to take this time to thank St. Louis Regional Chamber's 2020 public policy sponsors. Their contributions support all of our policy programming throughout the year. Closed captioning is also provided during these briefings, so feel free to use that feature in Zoom. First, I'd like to introduce the Chief Community Health Officer at SSM Health and Incident Commander for the St. Louis Metropolitan Pandemic Task Force, Dr. Alexander Garza. In his role, Dr. Garza is responsible for deepening SSM Health's focus on social determinants of health, equity, and social justice. Shortly after the COVID-19 outbreak, Dr. Garza assumed the role of Incident Commander for the St. Louis Metropolitan Pandemic Task Force, where he oversees the region's coordinated response efforts. I'd like to thank Dr. Garza for his leadership and for joining us this morning. Please welcome Dr. Alexander Garza.
Good morning.
Good morning, Doctor. The floor is yours, sir.
Yeah, so I'll be brief with my remarks, and I apologize for the weird lighting and everything. I'm in the back room away from a crowd, so again, my apologies. So I'll just really briefly go over sort of where we are in the pandemic, and we're at a very concerning time. I don't think I need to tell anybody about how the cases have dramatically increased. Our hospitalizations have been over 100 per day for the last 3 days. If we look at projecting out where this is going to go, it's going in a pretty scary direction. So you know that then tells us what do we need to be doing to prepare for the future, as well as how do we blunt the curve. And so I think Spring and Fred will talk a little bit about the actions that have been taken at the city and the county, all very appropriate. But really, what actions do we need to be taking as a community as well to slow the spread and to give the healthcare systems some room to take care of all of the patients, not just COVID patients, but all of the patients within the healthcare system. I'm incredibly blessed to have work with such a great team from across the healthcare systems, public health, and the business community. I think everybody wants the same things to happen to get control of the virus so that we can get back to a more normal time. It's not going to be normal until next year at some point. But that requires a serious amount of work and serious commitment, both from elected officials and from the community. So I'm going to stop there and happy to answer any questions. As I said, I've got about 5 minutes before I got to jump off and jump onto another meeting, so I apologize.
Thank you, Dr. Garza. The first question is really, where's the virus spreading in our region? Can you tell us anything about the communities that have been most impacted?
Yeah, and that's probably a great question for Spring and Fred as well, because they are much closer to the transmission data than I am. But from what we have been hearing from both of them is that it's spreading a lot within these smaller clusters of people coming together for informal gatherings, things like that. Now, after a while, you have so much virus that's out in the community, it becomes very difficult to prevent spread in really any sort of gathering. So whether that's in a restaurant, a bar, a gym, any place, and it's a pure numbers game. But from what they have told me, and again, they can correct me if I'm wrong, a lot of it is occurring with these informal gatherings of people in homes and other places.
Thank you, Dr. Garza. What kinds of measures would you like to see the federal government take, to help keep this virus under control?
Sure. So I think a mandatory masking mandate would be very helpful. It's very difficult to manage a pandemic when you have a patchwork of policy across multiple jurisdictions. And so I think that that is in order. Some sort of modified safer at home policy, I think, would be also advantageous. After a while, this doesn't become a rural versus urban problem or a state X versus statewide problem. If you look at the map now, there's growth all over the place. It doesn't matter if you're in Missouri or if you're in Iowa. And so having consistency in policy is extremely important for us to have an effective way to suppress the virus.
Thank you. And Dr. Garza, as you know, we had a great announcement from Pfizer this week regarding the COVID-19 vaccine. Is the region preparing for vaccine distribution?
We are, and so that involves a lot of people. So the healthcare systems, public health, our emergency managers, multiple different people are engaged in how we distribute the vaccine. It's a complicated process logistically, and part of that is because of the particular vaccine that it is. So this isn't, a simple flu vaccine that you can just ship out to any normal clinic. The Pfizer vaccine requires ultra cold refrigeration, of which we have limited capacity. It's mostly at the larger healthcare systems. And it's also a 2-shot vaccine. And so that requires an added level of administrative and logistics work to make sure that we're completing the series so that we are having immunity in the population. And so, and the other thing I would stress is that we're not going to have vaccine in large numbers for any short period of time. It's going to take a while. Plus, we don't have the manpower to do all the vaccinations. So there's multiple things. I don't want people to have this false assumption that we're going to parachute in vaccine and everything's going to be great. It's a light at the end of the tunnel, but what I tell people, it's a very long tunnel. And so we have to deal with the pandemic at hand while we get to the end of the tunnel.
Well, last question, Dr. Garza, I want to be respectful of your time. Are there any PPE needs in the area, and how can businesses help assist as we enter into the cold and flu season?
Yeah, we have not heard of any critical shortages in PPE. So in talking to our supply chain people, we think we're pretty well stocked with personal protective equipment. Now, with that being said, the environment changes every day. So we are certainly on exponential growth right now, which means we will increase our burn rate. And so, don't be surprised if I come back within 2 weeks and say, you know what, we're at a critical shortage now of PPE. Right now, we seem to be fine. We think we're okay. We think we've built up our stockpile. But again, at the growth rate that we're seeing, we're going to be burning through PPE on a rapid clip.
Well, Dr. Garza, thank you very much. On behalf of the business community in the region, thank you very much for everything that you're doing. You're saving lives, and anything that we can do to be of assistance, you know that you can reach out. Thank you for spending time this morning.
I appreciate it. It's a team effort. So everybody needs to be engaged. Thank you.
Thank you, Dr. Garza.
Mm-hmm.
Now joining us is the co-director for the St. Louis County Department of Public Health, Spring Schmidt. Spring represents the department across all aspects of public health and directly oversees environmental services, fiscal, personnel, administration, animal care and control, and the Division of Health Promotion and Public Health Research. Spring has also been responsible for large-scale strategic planning, including the Community Health Assessment and Community Health Improvement Plan. Please welcome Director Spring Schmidt. Director, the floor is yours.
Thank you. It's always hard to follow Alex, but I'll do my best. So I think that the urgency that we have right now in the things that we are trying to do is focused a lot on the fact that we have uncontrolled transmission in our community at this stage, as well as the outcomes that we're seeing and who is being impacted. So the hospital capacity is a significant issue for us. Because that doesn't just affect COVID cases, it affects all of the other things that we use our hospital systems for in any other emergency as well. And that has consequences. You talked about who is being affected. And at this point, because of the volume that's present in the community, it's everyone. But we have equity issues in St. Louis, and that means that those who often see the most significant outcomes are those that are most vulnerable. When we have this happen among our older adults, we've been seeing spikes for 2 weeks among county residents that are over ages 80. And so this is our most vulnerable and those who are at the highest risk. We have seen this in our underserved communities multiple times throughout this pandemic. And the consequences are always borne harder by different groups of people in our community, even though the virus is everywhere and may even be spreading more in other areas of our community. But it does impact different people in different ways for who is often most likely to suffer the biggest health consequences. Even though we have this level of uncontrolled transmission, and we have been over 800 or 900 cases multiple times in the last week, every single day in St. Louis County, we're now averaging almost 650 cases every single day. And the transmission reproductive rate being over 1, it's currently at 1.3, means that every person who's infected will infect 1.33 more people. So we are accelerating in the growth of this transmission across our community. But when we look and compare to others and we see that St. Louis County has had restrictions and lots of protections in place, and I know that we have a lot of good compliance in our community too, we have so many people that all of the areas in which we don't have compliance can get out of control really quickly. So there are multiple places in Missouri now who are averaging over 400 cases per 100,000 people a day. If that was happening in St. Louis County, it would mean that 4,000 people were being diagnosed with COVID every single day. And if that was the situation that we're in, if we had that level of uncontrolled transmission that we see in many of our neighbors, we would be talking about really catastrophic consequences. And so the city and the county both have had a lot of controls thus far, and we know that all of those are painful in a lot of levels. And we feel very strongly that our health and our economic health are both fully intertwined. They have been for a long time. We impact each other in a wide variety of ways. And so there's never a matter of choosing or prioritizing at any one given point of time. We are always trying to balance the policies that we create that help protect against some of our worst possible outcomes, because our successful getting through COVID as well as we can is our future, and is our economic future too. Alex talked a little bit about the vaccines and the timeline. I think I can be as specific as what we know, in that we don't expect for vaccines for those that are most vulnerable and first responder workers until the end of this year. We are not currently anticipating public-facing vaccines to be available until maybe late spring, early summer. As Alex was saying, we don't expect those to come in giant batches of 1 million vaccines ready to go. We will get small quantities, hopefully on a really regular cadence with a beautifully delivered federal system of distribution. But we have not seen that yet in this pandemic so far. And so we have relied on each other to manage through those distribution conversations, and that's what we're planning for now. We believe that we will have to continue to see lots of individual behavior changes. Many of our business behaviors change. Many of our community and social behaviors change and adapt. I would honestly forecast that we should be planning for an 18-month cycle in which we are looking at how, not that we will all be under the same level of orders that we are at right now. We will continue to adjust, but that we will be talking about how this is impacting our staff, impacting our customers, impacting our businesses, our community, and our hospitals, and our individual health. We will be talking about this for 18 months at least, because it is going to take time for all of the rest of these things, that vaccine, that light at the end of the tunnel, for it to be here, to be delivered, to get enough people to take it, to really start to impact this. And we will have outbreaks and virus in our community the entire time. And so the more that we adapt and innovate towards our behaviors, towards our service delivery, towards our economic activity, the more of the things that are so important to all of us that we can have, the better. I think those are many of the things that I wanted to make sure that we discussed today. There is Of course, new orders and recommendations and guidelines and supporting documentation that are up on stlcorona.com today. I know there'll be many questions about that. Please reach out to us. We're more than happy to answer any of the questions about how that applies to your business or how we can help balance all of these things that we're trying to work towards in our community right now.
Well, thank you, Spring. So how will those new, orders, generally speaking, impact businesses in the region?
So the broad base of the orders is that we're encouraging more individual behaviors for that people are in fact safer at home, and to only conduct really your own essential activities, whether that's going to work or going to school, or participating in social events in a very small social bubble. We did reduce occupancy again back to 25% in St. Louis County. We have talked about the fact that indoor dining and indoor activities in bars and restaurants are both areas in which we do still see transmission. We see a lot of rise in small gatherings, but we still see it in all of these other places and activities too. There is virus everywhere. And so those activities that foster that close contact, especially when you remove your mask to eat or drink, is a problem, and we do see those levels of transmission. We are concerned about big events, as we have been for a while, gatherings that are more than 10 people, and those I think are the predominant activities that are in our new order.
So that you mentioned, the holidays are coming up and many people plan to participate in, family gatherings, right? That's what Thanksgiving is all about. What's the best way, that folks can keep safe? Is it just to not do Thanksgiving at all this year? I've heard some people talk about 2 Thanksgivings next year, maybe. What are your thoughts?
I struggled with this in my own family. But Thanksgiving is my personal favorite holiday. It's a big deal to me. I love all of it. We are going to Zoom. We're going to do a dish swap among family members where we get together and we trade on each other's porches. We're going to cook. We're going to start a Zoom conversation, and we're going to try to sit down and eat and have as much communication as we can. So I'm going to try to have some of what it is that I love about Thanksgiving and spend some of that social connectivity time. But I have vulnerable people in my family. I have people who have compromised immune system. There are a number of children in my extended family. There are a number of older adults in my extended family. I will be spending my time with them virtually so that I do not become a source of exposure for them, or they become a source of exposure for me. This isn't about how much I trust my family. I trust my family implicitly. This is about how much is out there in the community.
Thanks, Spring. And, are you able to tell, St. Louis County is a big place, are you able to tell where the virus is spreading in our region and, what communities are most impacted?
So for the last several weeks, we have seen from a zip code perspective, so it is everywhere. Let me start with that. St. Louis County is big, and there is virus in every single zip code. We have been consistently seeing increased transmission for the last 4 weeks among our south and west zip codes, particularly those that border some of our adjacent neighbors. We see a significant number of that up across our north border in North County as well. But we also continue to see rising rates in those that are over 80 years old. That is a big concern to us right now. We have a lot of children right now, although that is not in proportion to like the number that we see. When there's virus everywhere in the community, it hits everywhere. So we have a lot more. The most adults are 20 to 60 that are out there, that are working, that are engaged and involved in our community in a wide variety of ways. And that is where the bulk of our cases come from. But for the last 4 weeks, the highest number of zip codes have been south and west.
So how closely are St. Louis city and county working together, and are other counties collaborating as well? That's a question that we always get from our members.
We talk a lot. So Fred and I talk and text and meet in multiple groups. We talk with St. Charles and Jefferson County quite a bit. We also talk with other health directors across the state, Kansas City, Springfield, Columbia, like many other groups that we belong to. We talk to the state. We work with each other as often as we possibly can. We all have different processes. We all have different concerns, and we all have slightly different things we see in our population. And that we know how much that contributes to some of the disparate activities. We would like to say that none of this jurisdictional thing ever matters to us, but it does make a difference.
Spring, do you have any reaction to, some of our political leaders maybe saying that there's no way to enforce a mask mandate? So such a mandate is basically useless.
So leadership matters. And I think that when you stand up for something and you think it's right and you understand the science, I think it's not just symbolic, but there is also symbolic power to the leaders who stand up and say, we need this mask mandate, as the city and county did a while ago. And our leaders said, this is important to you. And even if we're not out there punishing people for it, it matters that we have this impact, that we show this level of leadership, and we give it this level of importance that we think it deserves.
Thank you for that. And, businesses, this is the last question I have for you, are really obviously alarmed, right? Going into a season that we know we're seeing record numbers. What can businesses do to help protect their employees and customers, especially at this heightened time, especially, because they know that, shutting down the economy again has severe consequences?
I think that it's going to be difficult. We have to be more nimble than we've ever been before, adapting to what it is that we're seeing. Everything that we can do to innovate in ways that are contactless between our staff and customers, and between our customers is critical to us. I spent a lot of time advising all of the rest of our county government departments to be doing some of the same things, create barriers, create distance, create airflow. If you can't create virtual, but having those adaptations so that you can still find ways to serve, to deliver, and to engage. We have meetings in the health department where we're all sitting in our own office having a Zoom call because we're not going to get in a conference room together and risk that potential exposure to each other if we are all in fact in the office. It's critical that we figure out how to do these things. I have services that I can't that I must have people present for, my nurses and physicians that are delivering care to people. They must see them and be there. So others being in the building and interacting and risking those physicians and nurses being able to do their job, to be present for those community members is important. And so we've made calls about the programs that we've modified, programs that we have stopped, programs that we have adapted to do quite differently and we still have to do that. We still have more work to do in that space. It's hard.
Well, Spring, really appreciate you spending time with us this morning and letting us know what's going on in St. Louis County. And please pass along our appreciation to the county executive and, your team over there, for helping, keep us safe through this pandemic. Appreciate it.
Thank you.
Thank you. Now joining us is the director of the St. Louis City Department of Health, Dr. Fredrick Echols. Dr. Echols is the first medical doctor to serve as health director since 2007, and prior to becoming director, Echols served as the director of communicable disease, vector, and veterinary programs for the St. Louis County Department of Public Health, where he's responsible for overseeing daily operations, strategic planning, fiscal management of a multi-million-dollar budget, and program development and implementation. Please welcome Dr. Fredrick Echols. Doctor, the floor is yours, sir.
Thank you. I do have a few slides that I prepared, so if I can share my screen. I can't share my, is it possible for me to share my screen?
It should be now, Dr. Echols.
Okay. Okay. All right, so as Riley they mentioned, I'm Dr. Fred Echols, the Acting Director of Health for the City of St. Louis. I have no conflicts of interest to disclose. And the thing that drives the heartbeat of the City of St. Louis Department of Health is this mission and vision, which is to ensure that all residents in the City of St. Louis are able to achieve optimal health. The focus of this discussion is to give you an update on COVID-19 and where the city is. So as everyone knows, there's some additional measures that are being implemented starting tomorrow. And I'll talk about those towards the end of my presentation. But first, I'd like to just give you an overview of where we are with the a brief data review. So as we look back over the course of the city's response to the COVID-19 pandemic, We had our first wave in March, our second wave roughly in July, and now we're experiencing essentially our third wave of COVID-19 cases, our resurgence of COVID-19 cases. And so what we've seen, at least over the last 45 days, is almost 800% increase in the 7-day rolling average, going from roughly 25 to about 115 cases per day, which is again our 7-day rolling average. When we look at that more closely, what we're seeing is that the highest number of cases is associated with those individuals who are aged 20 to 39. But the behavior that is facilitating transmission in the city of St. Louis is small social gatherings. And so when we were thinking about, what measures we needed to implement, we had to really have a targeted approach to ensure that we were addressing the root cause of transmission in the city of St. Louis. And so again, I'll talk about the Health Commissioner's Order number 15 in a little bit. But looking at the cases, so we know that we're having a surge of cases in the city of St. Louis, but we also wanted to know where those cases were occurring. And so what we did was we mapped out, created this heat map showing which wards were affected, which neighborhoods were affected the most by, at least over the last 30 days. And what we see from this document is that the highest number of cases that have been detected in the southern part of the city. And so there are several hot spots in South City. So we're using this data to really drive our response. So it helps us define where we place resources in our communities. And we also do a better, we've worked with gatekeepers in those communities to make sure that the resources and information is getting to the individuals that need it. Of concern, is the notice that we're also seeing an increase in the cases in the central area of the city. And the concern is that if we have increased transmission moving upwards, we'll have significant issues, particularly in the North City, where we have our most vulnerable population, which are those who live in the highest poverty areas, as well as those areas that have the highest percentage of individuals who are either uninsured or underinsured. And so the strategies that we have to implement now are really necessary to slow the spread of COVID-19 to protect our most vulnerable populations. And to do that, as I mentioned before, so we're working with gatekeepers in the communities to make sure that we're able to get resources and information to all communities across the city of St. Louis, but especially those that are being heavily impacted at this time. We're working with the federally qualified health centers as well to make sure that we're able to offer testing at no cost for individuals across the city of St. Louis. We started that back in April or May, and we have continued that up until today. There are several testing events going on today and tomorrow for the community at large. And so this is really necessary to make sure that individuals who are infected know their status and they can be connected to proper treatment. We don't just encourage individuals to get tested. We also work with individuals who test positive and may not have a medical home. So we work with our partner, particularly the Integrated Health Network, to connect those individuals who are uninsured or underinsured to medical homes so that they can receive routine primary care services, which are necessary to help them achieve optimal health. And so we've been really working to implement a region-wide or system-wide approach to addressing COVID-19 or issues related to COVID-19 in the city of St. Louis. But again, the big concern here is that we have a significant number of cases occurring, or significant transmission occurring in the southern part of the city, but it appears that that the increase in transmission may be moving to the northern part of the city, which is extremely alarming. So now I'll talk a little bit about the regulations. So we've, prior to yesterday or today, we had 14 executive orders that had been adopted, and we have our 15th, which will be adopted on tomorrow. As we look at the regulation, we really want to focus on the root cause of transmission, the root cause of the spread of COVID-19 in the city of St. Louis. And so when we looked at the data, we looked at the data, but we also obtained information from cases during our case investigation. And what we were finding was that there are a lot of small gatherings occurring in private homes and private facilities across the city of St. Louis. And so that had to be our focus. We didn't want to cast a wide net, because we also understand that there are unintended consequences that typically occur with mitigation strategies. And the groups that typically bear the brunt of that are those who are most vulnerable, so those who have low living wages, those who are uninsured, and those who have underlying medical conditions. So we had to be really mindful of that. And so we want to do our very best to protect that population. And so we have a really focused approach, and our approach for this strategy is to really focus on private gatherings, which is really important with the holiday season coming up. And so the executive order number 15 does a couple of things for us. So one, it gives us, prohibits private gatherings of 10 or more. So those gatherings that would typically occur in homes and other social settings, those are, if there are 10 or more people, those are prohibited up until further notice. And so we also use this as an opportunity to remind businesses of the pre-existing requirements. So the face covering, social distancing, employee screening and exclusion, as well as the cleaning and disinfecting requirements that are listed several times in previous orders, but also other standards that were outlined in executive orders number 8, 9, 11, 13, and 14 that still remain in effect. And so again, we didn't want to cast a wide net with executive order number 15, but we wanted to really focus on the root issue that has resulted in widespread transmission. We understand that also a lot of the mitigation strategies that have been implemented in the city of St. Louis have also caused economic hardship for individuals and businesses. We really appreciate the work that the businesses have done over the last several months. They've been very innovative. They've been open into thinking outside of the box to meet the city's requirements or to comply with the city's requirements. So we really appreciate a lot of the work that the businesses have done. We continue to work with them on a daily basis. Prior to finalizing executive order number 15, we had some really frank discussions with leadership across in the city as well as the region. A couple of those individuals that we talked with were Archbishop Rositsky as well as Bishop Hankerson, because we also understand that churches and other places of worship can be a place of transmission, but again, that's not what we're seeing in the city of St. Louis. We work with our clergy advisory board at the health department to ensure that accurate information was issued to all and made available to all worship entities in the city of St. Louis. And we also have worked with churches and other agencies, other religious organizations to develop operation plans so that they could return to in-person worship in a safe and responsible manner. A lot of them have very strict protocols in place that they've been adhering to, which has prevented their place of worship from becoming an epicenter for transmission. So we really appreciate the work that our communities of faith have done to comply with city requirements and to protect their parishioners. But again, overall, the system has really come together to really lift a lot of the critical work. And we couldn't be where we are in the city of St. Louis without the support of businesses and the compliance of businesses. Although we have the majority of businesses complying with city requirements, there are some that seem to struggle a little bit. So we do have a protocol in place. So I also want to take a few minutes to talk about what that protocol is. And so when we find out that a business is not compliant with city requirements, there's a few steps that have to be that are taken by the health department. So we receive complaints either by through a variety of mechanisms. One could be through our email, which is health@stlouis-mo.gov, or through the Citizen Service Bureau in the city of St. Louis. So when the health department receives these complaints about businesses that are not complying with city requirements, we have staff in the health department that actually investigate each complaint. So the staff investigate the complaint, and if we're able to verify that the business is violating city requirements, then we issue a warning notice. And the warning notice is really important because it gives the business owner an opportunity to really revisit city requirements with their staff. Remind them of what the regulations are, remind them that face covering requirements are, face coverings have to be worn during their shift, that they have to socially distance themselves, they have to implement the hygiene requirements and so forth. And so we give them an opportunity to get their act together, if you will. But then if we find that the business continues to not comply, we have to take additional measures. because we are in the middle of a pandemic and lives are at stake. We hear the information from the St. Louis Metropolitan Pandemic Task Force representatives daily about how the hospitals are essentially overwhelmed at this point. They have the ICUs are at 90% capacity, the inpatient beds are at 90% capacity, and lives continue to be lost due to COVID-19. And so for those businesses that continue to not comply with city requirements, if we get additional complaints, we investigate those complaints just like we do the initial complaint. And if we are able to verify that the business is not complying with city requirements, then we issue a closure notice. So the business will be closed for a defined period of time. And prior to reopening, they have to resubmit their operation plan as well as undergo infection control training, which is provided by the health department before they can reopen. And so we really want to do our best to work with businesses. And again, the majority of businesses in the city of St. Louis are complying with the city requirements, and we appreciate the great work that they're doing. But there's always a few bad apples in the bunch, and so we try to help those bad apples become good apples by providing them with resources and support so that they can comply with city requirements.
Dr. Echols, thank you very much. A lot of really good information in there. And I just got time for just a couple questions. Health order number 15 doesn't apply to the day-to-day operations, as I understand it, for businesses. Do you foresee these health orders becoming more restrictive as we head into the winter months?
So there's always the potential for that, but what we aim to do is set up businesses and the community for success. So we continue to remind businesses and individuals of the city's requirements. And so if businesses and individuals comply with the city's requirements, we can slow the spread of COVID-19, and additional mitigation measures shouldn't be necessary. But addressing or changing behavior can be very challenging. And so if we identify other areas that need to be addressed, we may have to amend the current order or draft new orders to make sure proper restrictions are in place, again, to slow the spread of COVID-19, to protect the health of our community, as well as our public health and hospital systems.
Thank you, Dr. Echols. And last question, we've heard a lot about rural hospitals being overwhelmed, so they're sending patients to the St. Louis region. How is that impacting hospitals and treatment?
It's having a significant impact on hospitals. So one, we have to understand why the medical infrastructure in the more rural areas is very frail, or in some cases non-existent. So when the state failed to expand Medicaid, the financial resources that were necessary to keep the hospitals, medical clinics afloat, it dried up. And so I believe over 14 hospitals in the rural parts of the state of Missouri had to close because there wasn't proper funding. And so that in itself leaves those communities very frail and more vulnerable to unintended consequences of a pandemic. And so because individuals do need medical treatment, some do need to be hospitalized, they have to transfer them to an area where they can receive proper medical care. And so by having hospitals in the city of St. Louis, or large hospitals in the city of St. Louis or St. Louis area receive those patients, that takes away from the availability of beds for people that actually live in the city of St. Louis and live in St. Louis County. So it's having a huge impact on the capacity of hospitals, which impacts their ability to provide care for individuals that need it. And so as I mentioned before, over 90% of some of the intensive care unit beds are occupied, and over 90% of the inpatient beds in the hospitals are occupied because of that. And so it's having a significant impact on the hospital's ability to provide care.
Dr. Echols, thank you very much. Really appreciate that. And, please pass on, our thanks and appreciation to Mayor Cruzen and your team over there in the city. We really appreciate, everything that you all are doing to keep city residents safe.
Thank you, will do. Thank
you. And now joining us, and we're experiencing hopefully not a technical difficulty, but seeing if we're able to unmute the line of Executive Director of the St. Clair County Health Department, Barb Hohlt. Barb, are you with us?
Hello, this is Barb. Can you hear me?
Hi, Barb. Sure can. Really appreciate you being with us. And just want to let our listeners know that you were appointed executive director in 2015 and joined St. Clair County Health Department in 1986. Through the years, Ms. Holt's career has advanced to her current position of executive director. Prior to becoming executive director, Ms. Holt served as deputy director and director of health protection, where she was responsible for overall administration of health protection programs, including environmental health, environmental protection, infectious disease control, and emergency management, and a staff of 22 employees. So please welcome Barb Hohlt. Barb, thank you for being with us. The floor is yours.
Absolutely, and I'm very privileged to have joined this group of very prestigious folks within our metropolitan area with Dr. Garza and Spring, as well as Dr. Echols. Again, I guess it started out as Friday the 13th because my computer blew this morning, and so we were frantically working to get things fixed. So Friday the 13th. But a couple of things I do want to mention, and again, even though we're in Illinois, we all know that disease doesn't stop at county or state lines or rivers. And so we are all experiencing the same issues of COVID-19 being spread everywhere. It's in all our communities, all our zip codes, our young, the middle-aged to elderly populations. It knows no boundaries. At the beginning of this COVID, it seemed to affect those immunocompromised or those older populations at the beginning. Well, now it isn't. It's everywhere. Illinois is a little bit different with our mitigation efforts. Early on, Governor Pritzker set up different levels statewide for the control of COVID and the COVID pandemic. So we had in place specific positivity rates that if a region, and Illinois was divided up in the 11 regions, that if a region's positivity rate was above 8% for a rolling average for 3 days or more, then we would be put into additional mitigations. Those mitigations, again, included such things as limiting indoor dining, limiting social gatherings. Right now, that is at 25 or less. We expect that to even go lower, especially for those that are now in Tier 2. So there are a lot of things, and across the state, the governor has implemented these mitigation orders. Several things, especially, and we're in Region 4, which includes St. Clair, Madison, Bond, Clinton, Washington, Randolph, and Monroe County. We experienced mitigation efforts early on and had some closures of indoor dining. That was through the summer months. And we were able to then get our daily positivity rate below 6.5%. And we were able to open up again. Well, as we all know, and as St. Louis is doing now, both in the city and the county, indoor dining is bars and restaurants, and indoor dining is an area where we see a lot of the spread of this COVID virus. And so the governor's mitigation orders have closed indoor dining in Region 4 in our region. That's been since October 28th. And we expect that to continue for some time yet, because our positivity rate, especially in the last 2 or 3 weeks, has gone into the double digits. Statewide, we're 13–14%. Countywide, St. Clair County, we're about 10–11%, but we are grouped in as a region. So Region 4, I think the latest, we're about 14%. Positivity rate. It's going the wrong way. Our daily counts, our population of St. Clair County is about 265,000 folks. And we would average, 2 weeks ago, we'd average between 60 and 80 positive cases a day. Within the last 2 weeks, we've gone from 150 to 180 up to 212 positive cases a day in St. Clair County alone. So like everywhere, the positivity rate, the incidence of disease with COVID has just gone through the roof. We highly encourage, I mean, again, as Dr. Garza and Spring and Dr. Echols spoke, you know, we are working, we're getting close to getting a vaccine, but it won't be an immediate fix. But obviously, the vaccine will come in chunks, so to speak. We'll need to immunize priority populations, especially our health and safety groups, our medical providers, our law enforcement, those essential personnel. First, once we get this, as well as our target population, those that are most vulnerable. And again, due to the amount of vaccine that we will receive, as well as the ability for our medical providers to distribute the vaccine in our community. I mean, we all are working on vaccination plans, mass clinics, working with our local hospitals and pharmacies, as well as our own health department, for plans to have drive-through vaccination clinics. So that's in the future, but it's not here now. So one of the things, again, I want to emphasize is the tools we have in the toolbox now, as Spring and Dr. Garza and Dr. Echols have emphasized, is masking. Masking is so important, both for, you know, the individual to be wearing the mask, as well as the people you're around. It's simple. It's not hard. It's not very restrictive. And it's in respect for our fellow family members, our co-workers, our neighbors, our own citizens. It's for our own public health. We need to wear our mask. We know that's proven to help stop the spread, or help control, or help minimize the spread of this pandemic disease. It's killing people across our counties, our states, across the United States and across the world. So that's the least we can do, as well as the social distancing, you know, at least 6 foot of social distancing, and you know, wearing our mask. As Spring said, you know, within our own offices, instead of going visiting someone else in another office, pick up the phone and call them. Do everything we can in our businesses, in our own homes, to help prevent the spread of this disease. These are tools we have in the toolbox now that we know work. Another thing that we really need to emphasize, again, because this disease is everywhere, please get your flu shots. We can't emphasize that enough, because COVID has various symptoms that are very similar to the flu, but we sure don't want folks to have both the seasonal flu on top of becoming ill with COVID, to, you know, to really stress our immune systems and our health. So we can't encourage enough for everyone to please get your flu shots. Again, yesterday, Department of Public Health also encouraged across the state that if possible, if employers can allow their employees to work from home, especially for the next 3 weeks during this holiday time, it would be very helpful to help curb some of the spread of this disease. Also, to please limit your travel, please limit your gatherings, your social gatherings. As Spring said, you know, it's Thanksgiving time. We want to be with our families. And I too, Thanksgiving is one of my favorite times of year, where we love to cook. We love to have all the food in the whole wide world. But my family we have several folks that are immunocompromised. We have babies. We have folks that are older. So we need to respect their health, as well as those in the rest of our community. Again, as Spring said, it's not that we don't trust our family, but people can be asymptomatic and be carrying the disease and spread it, and you don't realize it. So with that, again, we encourage everyone to please get tested. If you feel ill, please stay home. Please wear your mask, do your social distancing, maintain your distance from folks, wash your hands. Those basic sanitary, personal hygiene issues are just so important, and those are the tools we have in a toolbox. Everyone's tired of this disease, and please don't become complacent. Please wear your mask. Please don't wear out yet. I mean, I know everyone's so tired of this. This has been going on for what, 9 months now, 10 months. And as we said, it's not going to be over in a few months. We're looking into the spring and next summer before we have enough vaccine for our general population, and we need folks to take that vaccine as well. So with that, again, one other message that I want to pass along is, I know both across the nation, St. Louis City and County, the state of Illinois, St. Clair County, and all our regions, we have contact tracers that call and follow up with positive cases. Please answer the phone when they call. Please be honest in your answers of who you may have been around. I know people are very concerned that if I tell you, you're going to tell them that I'm sick. We all are under HIPAA regulations that we're not allowed to say who is positive. We need that information to get in contact with those that you've been around to help control the spread of this disease. Again, those contacts you were with may not show any symptoms, and they could be out there spreading it, and they don't know that they've been in contact with someone that's positive. So please be very honest and forthcoming. If you are a positive case, please isolate for your 10 days. If you're a contact to a case, please quarantine for those 14 days. I know it may be a hardship with work and children and babysitting, but those are the things we know we can do to curtail this disease at this time. So again, please don't become complacent. Please follow the 3 W's and get your flu shot. Visit our website, St. Clair County Health Department website. We have testing clinics throughout the county, 7 days a week, and we highly encourage everyone to get tested. So with that, if anyone has any questions, I'll be glad to try to answer those.
Director Hohlt, really appreciate that. I think everybody in the call can, feel your passion around, keeping the region safe, and, particularly on masks. I just got off a call with some of our, most important investors who, are really vocal about ensuring that our businesses in the region, that the community and our, 2 states are making sure that people are wearing masks is, the easiest and most effective and cheapest tool to fight the pandemic. So, really appreciate that message. And so Illinois has had a different, kind of tighter restrictions since the pandemic began than in Missouri. How do you think that's impacted cases in Southwest Illinois?
I think it was doing great. Our numbers and our positivity rate really showed that we were doing pretty darn good with trying to control the spread of the disease. Our positivity rates were lower, but I think as again, it's everywhere. But as the weather gets colder, as time goes on, people are indoors more. People are getting tired and complacent of this is lasting forever. And I think we're starting to let our guard down. And I think that's a big deal of why we are seeing so many more cases going on now. Businesses are struggling to stay open. We totally understand that. They need to operate to be able to survive. And it's very challenging. But again, it's everywhere. And with the colder weather, we're chasing people indoors. And when we're indoors, even with our own family, we're all out and about in different places during the day. Even at home, we need to make sure we try to protect each other by maintaining our distance and doing those proper hand washing and following the rules at home, as well as trying to minimize how much you're out and about.
Director, what can businesses expect, as far as restrictions moving into the holiday season?
Again, historically, now under Tier 1 mitigations in the state of Illinois, there is no indoor dining allowed in bars or restaurants, minimum of 25 folks at social gatherings. As the Governor Pritzker stated yesterday, it looks like our numbers are going up, that many places, regions in Illinois are already at Tier 2 mitigations. I wouldn't be surprised if our Region 4 and several others across the state move into Tier 2, which essentially says, just like St. Louis did, gatherings need to be limited to 10 people at a time. Further enforcement, if necessary, what we did in the past in the springtime when things were shut down, that may shut down the such things as beauty salons, those non-essential businesses and services. We're trying to keep from doing that, and that's why we can't encourage people enough to please do what you can for all our businesses to be able to remain open. Please follow those 3 W's. Please wear your mask. Please try to do everything you can to limit your travel and limit the spread of disease for everyone's sake.
Thank you, Director. And just last question, what kinds of measures, from your perspective on the Illinois side of the region, would you like to see the federal government take to help get the virus under control?
Oh, absolutely. Make it a federal mandate across all states to wear a mask. I think that is one of the best things we can do. Another thing that they're working on is having rapid tests for individuals to be able to, we have rapid tests, but we need to enhance those a little bit, because some of the antigen testing, if you're positive, you can pretty much bank on your positive. But if they're negative, sometimes the efficacy of the negative test could be a little misleading, that you could get some false negatives. So I think enhancing the ability of having rapid tests, because people want to know right away. We have a lot of testing clinics with the PCR testing that may take a few days. A lot of testing, people want to know right away. And in the meantime, we encourage them to stay home. If you feel that you've been exposed or you have any signs or symptoms, to, yes, get tested, but stay home in the meantime until you receive your results. And sometimes that can be 3 to 5 to 6 days, because the labs are very, very busy. So again, a statewide and nationwide mandate of masking, as well as offering additional testing and rapid testing machines to our communities.
That's really good information. No, thank you very much. Executive Director Barb Hohlt, we really appreciate you joining us today, and please pass along, our thanks and gratitude to Chairman Kern and, folks over in St. Clair County.
I will do that. One more thing I may add, again, for our St. Clair County, we have each and every day, 7 days a week for 240 and 50 days now. We've been trying to be as transparent as we can and keeping our community apprised of what's going on in St. Clair County. So every day at 3:30 on our St. Clair County Emergency Management Agency Facebook page, we have a live video of our daily stats and information of what's going on. So that's 3:30 every single day, 7 days a week on the St. Clair County Emergency Management Agency Facebook video page. So that's the best and most current information we can offer in our community. So please tune in.
Thank you very much, Director. Especially right now, communication matters and information matters. So really appreciate that.
Absolutely. It's a team effort for everyone.
Yes, it is. Yes, it is. Thank you very much. Have a great day.
Thank you.
And thank you, everybody, for joining our COVID-19 briefing with our regional health leaders. As our region continues to see a rise in COVID-19 cases and wrestles with the threat of renewed lockdowns and restrictions, St. Louis Regional Chambers remains committed to serving as a resource, a convener, an advocate for our members, investors, and community partners during these challenging times. So thank you, everybody, again, for joining our virtual meeting, and this meeting is adjourned.